Welcome to our exploration of vector-borne diseases. These diseases are transmitted by vectors, living organisms that transfer infectious pathogens between humans or from animals to humans. This video will delve into how these vectors operate and the diseases they spread. We'll also discuss preventive measures to combat these illnesses. Let's begin our journey into understanding vector-borne disease transmission. Vectors are living organisms that transmit infectious pathogens between humans or from animals to humans. Many vectors are blood-sucking insects ingesting disease-producing microorganisms during a blood meal from an infected host. They later transmit the pathogen into a new host after the pathogen has replicated. Once a vector becomes infectious, it can transmit the pathogen for the rest of its life. Understanding vectors is crucial in controlling the spread of diseases. Vector-borne diseases are illnesses caused by parasites, viruses, and bacteria transmitted by vectors. These diseases account for more than 700,000 deaths annually. Malaria, dengue, and yellow fever are among the most common vector-borne diseases. Each year, these diseases affect millions of people worldwide. Let's explore how these diseases impact global health.
The most common vector-borne disease is malaria, transmitted by female mosquitoes. This is a biological transmission, where the infectious agent grows inside the mosquito. The protozoa Plasmodium, responsible for malaria, reproduces in the mosquito's gut. It then migrates to the salivary gland, ready to infect humans. Understanding this process is key to malaria prevention.
The Anopheles mosquito is the primary species responsible for transmitting malaria. This species is found in many parts of the world and is a major contributor to the spread of malaria. The mosquito's ability to carry and transmit the Plasmodium protozoa makes it a significant vector. Controlling Anopheles populations is vital in reducing malaria cases. Let's delve into the role of Anopheles mosquitoes in disease transmission. There are 4 species of Plasmodium that infect humans, each with unique characteristics. Plasmodium falciparum is the deadliest, responsible for most malaria deaths in Africa. Plasmodium vivax is widespread and can cause chronic disease. Plasmodium malaria can exist in the blood for decades without symptoms. Plasmodium ovale is rare but can cause relapses. Understanding these species helps in malaria treatment and prevention. Dengue is a viral infection transmitted by Aedes mosquitoes, affecting billions worldwide. It causes severe flu-like symptoms and can lead to dengue hemorrhagic fever, a potentially lethal complication. The disease is prevalent in tropical and subtropical regions. Preventive measures include mosquito control and vaccination. Let's explore how dengue impacts global health and what can be done to prevent it.
Ticks are vectors for Lyme disease, a bacterial infection causing fever, headache, and fatigue. If untreated, it can spread to joints, the heart, and the nervous system. The disease is prevalent in North America and Europe. Early detection and treatment with antibiotics are crucial. Understanding tick behavior and habitats can help in preventing Lyme disease.
Body lice are vectors for typhus, a disease causing fever, headache, and rash. Typhus can be severe, leading to complications if not treated promptly. The disease has historical significance, affecting populations during wars and disasters. Modern hygiene practices have reduced its prevalence. Let's examine how body lice transmit typhus and preventive measures.
Rabies is a viral disease transmitted through bites from infected carnivores, such as dogs. It affects the central nervous system, leading to brain inflammation and death if untreated. Vaccination of pets and wildlife control are effective preventive measures. Rabies remains a concern in regions with high stray animal populations. Understanding rabies transmission is key to prevention.
Preventing vector-borne diseases are preventable through protective measures and community mobilization. Using insect repellent, wearing protective clothing, and sleeping under mosquito nets can reduce the risk of infection. Vaccination and public health campaigns also play a crucial role. Community involvement is essential in controlling vector populations. Let's discuss strategies for preventing vector-borne diseases. Climate change impacts the spread of vector-borne diseases by altering habitats and vector populations. Warmer temperatures can expand the range of mosquitoes and ticks, increasing disease transmission. Understanding climate factors helps in predicting outbreaks and implementing control measures. Public health strategies must adapt to these changes. Let's explore the relationship between climate and disease spread.
Global health organizations are working to combat vector-borne diseases through research, funding, and public health initiatives. Programs focus on disease surveillance, vector control, and vaccine development. International cooperation is crucial in addressing these global health challenges. Public awareness and education are also key components. Let's examine the role of global health initiatives in disease prevention.
Africa bears the highest burden of malaria, with millions of cases and thousands of deaths annually. Efforts to combat malaria include distributing mosquito nets and providing access to anti-malarial drugs. Community health workers play a vital role in education and treatment. Challenges include resistance to drugs and insecticides. Let's explore how Africa is addressing the malaria crisis.
Southeast Asia faces a significant dengue challenge, with frequent outbreaks affecting millions. Efforts to control dengue include mosquito eradication programs and public health campaigns. Vaccination is also being explored as a preventive measure. Community engagement is crucial in these efforts. Let's look at how Southeast Asia is tackling dengue fever.
Lyme disease is a growing concern in the USA, with rising cases in recent years. Efforts to combat Lyme disease focus on tick control and public education. Early detection and treatment are emphasized to prevent complications. Research is ongoing to develop a vaccine. Let's examine how the USA is addressing the Lyme disease threat. India faces a significant rabies challenge, with thousands of cases annually. Efforts to control rabies include vaccinating stray dogs and public awareness campaigns. Access to post-exposure prophylaxis is crucial for prevention. Community involvement is key in these efforts. Let's explore how India is tackling rabies.
Vector-borne diseases have a significant economic impact, affecting productivity and healthcare costs. Malaria alone costs billions in lost productivity annually. Investing in prevention and control can reduce these economic burdens. Public health initiatives can lead to long-term economic benefits. Let's discuss the economic implications of vector-borne diseases.
Technology plays a crucial role in controlling vector-borne diseases. Innovations include genetically modified mosquitoes and advanced diagnostic tools. Mobile technology aids in disease surveillance and public awareness. Research and development are key to future advancements. Let's explore how technology is shaping disease control efforts.
Controlling vector populations presents numerous challenges, including resistance to insecticides and environmental concerns. Integrated pest management strategies are essential for effective control. Community involvement and education are crucial components. Balancing control efforts with environmental protection is vital. Let's examine the challenges in vector control.
The future of vector-borne disease prevention lies in innovation and collaboration. Research into vaccines and new control methods is ongoing. Public health policies must adapt to changing climates and vector behaviors. International cooperation will be essential in these efforts. Let's explore the future directions in disease prevention. Vector-borne diseases pose significant global health challenges, but prevention and control are possible. Understanding vectors and their behaviors is key to combating these diseases. Public health initiatives and community involvement are crucial. Together, we can reduce the impact of these diseases. Thank you for joining us on this journey of exploration.
Thank you for watching our video on vector-borne diseases. We hope you gained valuable insights into disease transmission and prevention. Stay informed and proactive in combating these global health challenges.